had more deaths after it had been Operation Copper had been announced. That dread, oh my God, I've got another death. And actually, the numbers of people who died of COVID are very skewed, because there's lots of people who just took unwell were classed as suspected COVID without any test being carried out. So there was lots of workload that actually, because it seemed that other kind of health conditions didn't exist during COVID, and if you took unwell when you were living in a care home, you were just automatically considered as being COVID positive.
Scott clearly said it wasn't all about COVID positive deaths. It was suspected COVID or COVID related, where it may have been another underlying health condition. Lisa Di Giacomo, I'm a director with Oakminster Healthcare.
Scott Finnegan, Group General Manager for Thistle Healthcare.
Thank you. And how many care homes does Oakminster operate in Scotland? 5. And how many residents, roughly?
About 330.
And how many staff do you have operating?
About 340.
And some similar questions for you, Scott. I understand you're Group General Manager, Operations and Quality Improvement for Thistle Healthcare Limited.
Yes.
And how long have you held that position for?
7 years.
And how many care homes does Thistle operate?
7 care homes under Thistle and 3 associated care homes.
And again, in what parts of Scotland are those homes located?
Central Belt, mostly Lanarkshire area, but 1 in Glasgow and 1 in Dundee.
And how many residents fall under the care of those homes?
750 approximately.
And how many staff?
Between 900 to 1,000.
I wanted to move on to Operation Copper, because it's something that you specifically mentioned in your statement. I mean, as you'll be aware, and as is clear in the inquiry's terms of reference, the inquiry very much respects the independent role the Lord Advocate has here in relation to the prosecution of crime and investigation of deaths in Scotland. But in keeping with the purpose of these hearings, impact hearings, I would like to ask you about the impact that had on your staff. I'd like to take that in 2 stages if I can. First, I'd like to ask, what was the effect of Operation Copper upon the workload or administrative responsibilities that your staff had to carry out?
I think that was an inevitable increase in that. You had, when somebody had passed away from a COVID or suspected COVID death, you would be contacted with the police. You had to fill out this questionnaire with 37 questions on it. You had to provide numerous pieces of evidence and documentation with that, including copies of all the guidance that had been issued from the Scottish Government, which was readily available on the Scottish Government website. And 6 months worth of off duties for staffing, contact details. It was a huge piece of work that actually we had to have somebody solely working on that to facilitate it. Also distressing for people who've these staff have cared for a lot of these residents for a long time, and care deeply about the people they support, and then it was almost been an inference that they felt they were being questioned about, did they actually support somebody correctly. So it was a huge increase in workload.
And I was going to ask that. I mean, what's the impact of this upon the staff, on their morale, I suppose, or mental well-being in light of this investigation?
It was devastating, and I remember, apart from the task, because a lot of this information was archived, and so you had this questionnaire, and as Scott said, all this information going. But for me, it was one of our managers, and after our managers were on the floor during the pandemic in uniform, as were our ops team, supporting the staff, trying to keep morale up, lending a helping hand. And she came, and the manager sat at her desk, and she opened an email regarding Operation Copper. And the subject line was major crime. That came into her inbox. And the signature on it was from the detective sergeant of Operation Copper, Major Crime Division, Major Crime Police Scotland, or Serious Crime Division it was. And she just broke down. She just, now, there was probably no intention behind that. They were given a job to do and they were doing it as they would normally. But for somebody who's seen we had a staff member, young lady, who contracted COVID, spent several months in hospital, and is now at home with her young family, and she hasn't been able to speak since then. And our managers are still doing sort of welfare meetings. Care staff have lost their life, as have many. But to sit after your shift and ready to do your paperwork and to be greeted with that kind of email is just devastating. And she broke down because there's an inference of we've done something wrong. We haven't got something right.
And how did you manage that with your staff to the extent that you could?
Support them, reassure them, actually go in and take some of the burden away in terms of the paperwork side of it and the questionnaires. But there's ultimately information that they will have that we need to get from them. But as it's still going on, it's just still it's just devastating because we're the only sector to come under that kind of scrutiny. And nobody really knows what it was like for us during that time. I think somebody had described it as a war zone, and it was a bit like that, only they were trying to get statistics and information from us at the same time, so it was really hard.
You mentioned paperwork. And you touched on this in the statement, the administrative burden that I think your staff were all facing. I think words like staggering and immense were used. I wonder if there are any specific examples you could give of that, and I suppose also what you think might have eased that burden looking back.
I think it's just answering these 37 questions. I think and providing all the supporting documentation that went with that. And as I mentioned there, I think there was some of this that actually could have been given from. They're asking for guidance issued by public health. Well, we're then away gathering up all these different versions of guidance to provide that could have been something that could have been got from public health. I think it's just the immense workload in terms of every resident having to go through that, and that presented an ongoing when we had more deaths after it had been Operation Copper had been announced. That dread of, oh my God, I've got another death. And actually the numbers of people who died of COVID are very skewed because there's lots of people who just took unwell were classed as suspected COVID without any test being carried out. So there was lots of workload that actually, because it seemed that other kind of health conditions didn't exist during COVID, and if you took unwell when you were living in a care home, you were just automatically considered as being COVID positive. And I think there was a lot of frustration about that as well, because the numbers don't actually reflect the amount of people that sadly passed away with COVID.
Yeah, I would agree with everything that Scott had said. It was really when the staff, they came in with newspaper articles, and the care homes, it was almost like a league table with the highest number of COVID deaths against the name of that particular care home, and then it was in descending order. And that was just, it was devastating to see, because they didn't see the other side of it, of what they were facing. We had staff were sitting with residents at end of life when families couldn't come in, trying to reassure them, praying with them in some cases, because for the residents, the staff were the nearest thing that they had to family. And then to see you on a sort of league table with the COVID deaths. And as Scott clearly said, it wasn't all about COVID positive deaths. It was suspected COVID or COVID related, where it may have been another underlying health condition.
You mentioned media coverage there. I was going to come on to it anyway. And in your statement, you say at paragraphs, I think 104 to 106, you talk about being very unfair and one-sided, and you've given an example of it, of that there. Scott, I was going to ask you, what was the impact upon your staff? Did you experience something similar in terms of headlines? Or?
Yes, I think there were several of our care homes that were featured in news articles. Inevitably, they were all viewed quite negatively. And I think there was also that fear of, oh, people know that I work here, and do they think that that's what would happen in here? And because it was very generic information, but that also presented lots of anxieties for relatives, because relatives can't get in to visit. They're reading these headlines, and residents who have capacity were reading these headlines and saying, how can they be saying this about the place that I live, my home?
What would you highlight to this inquiry in particular about the physical and mental health impact that occurred on your staff?
For those who have remained in the sector, I don't think it'll ever be the same again. Some of them are still haunted by the images they saw at the time, bearing in mind we are a care home. We don't have access to oxygen or ventilators, and our residents were not being admitted to hospital, which some may argue is a basic human right. If you are not well and you need hospital admission, that you should be allowed to have that admission and not be discriminated against. So I think for those who are still with us, it will never leave them, and it's something they have to carry. I think for the sector, we've lost some good people who just couldn't carry on and couldn't take it anymore.